Hello, and welcome to another episode of MantaCare's Patient from Hell Podcast Club. My name is Mike Linn, and I'm a patient advocate here at Manta. And while I'm usually the host of the show, today I'm going to be the guest, while Marissa, who is the marketing director at Manta, is the host. And today's episode is funded by the Patient Centers Outcomes Research Institute, or PCORI. And the goal of Manta's collaboration with PCORI is to bring doctors and researchers onto the main podcast, the Patient from Hell podcast, and for them to share about their research or their experience so that more of us can learn about it and apply it in our daily lives as cancer patients or caretakers. Maybe to put it more simply, this is a bridge between the studying that people do in the clinical sense and how we apply it in our daily lives as cancer patients. And so the episode we're discussing today is going to be where Samira, the founder of MantaCare, sat down with Dr. TJ, who is a gastrointestinal medical oncologist at the Dana-Farber Cancer Center. And if you haven't watched the episode itself, I highly recommend you take the time that you do. But basically, we're going to be discussing how there is a rise in the onset of young colorectal cancer, what it means to be screened for colorectal cancer, and then the role of education overall in cancer awareness. So I'm going to turn it on over to Marissa, so take it away.
Thanks, Mike, and thank you for having me as a host. I'm very excited to talk to you today. Let's get into it. So TJ was talking about young onset colorectal cancer and how it's kind of on the rise. Do you have any knowledge about that?
Yeah, so while I'm not a colorectal cancer patient myself, I have worked a lot with colorectal cancer patients in my advocacy. I've dealt with members of Colon Town or Man Up to Cancer who both deal with, colorectal cancer. And what Dr. TJ was talking about is how there's a spike in young diagnoses of colorectal cancer. And I think this is actually true for many cancers. For example, I'm a stage 4 metastatic melanoma patient. There's also a rise in young melanoma diagnoses. And what Dr. TJ referred to that I thought was poignant in colorectal cancer is that it happens for a number of reasons. The happens meaning we get these earlier onset diagnoses. And his take is that much of it is environmental, meaning the things that we're putting into our bodies or the things we're exposed to as people in modern times, born after 1970, that's going to contribute to the rise of colorectal cancer. And similarly, as we get better at screening for them and the protocols change there, we're going to catch it more often. So it's kind of like, the rise in autism rates, for example. It's not that autism didn't exist or colorectal cancer didn't exist in younger people prior to, 2000 or whatever. It's just that we're better at detecting it. And so it happens more, which makes it even more important to get out there and screen for it, knowing that we can catch it earlier.
The comparison is also what I was thinking of like when people talk about neurodivergence or ADHD being on the rise or anything like that. It's really just like more people are aware that it exists and can identify it sooner rather than later. So that makes total sense that it would be on the rise, but More so, just being identified earlier. And also, environmental factors. That is a big one for sure. It's very interesting to hear his take on it and just everybody in the community talking about, how external versus internal impacting you versus, genetics. So all of those conversations are very interesting.
Yeah, I think that when we're summing up how cancer happens, which again, it's a very broad and very well-studied topic that still doesn't have any finite answers because there's not one answer. The way that I've always viewed it is there are a number of things that can contribute to cancer. It's all these buckets that, that contribute to a mitochondria breaking in a cell that will ultimately lead to mutation. And if you can limit any of them, that's great. But then also you have to identify the things that contribute to that. And as we get better and better at studying how this happens, we are finding more and more environmental factors, meaning, okay, we have to be more careful about these things. We have to learn how to screen and educate people.
Yeah, when talking about like educating people and stuff like that, he kind of talks about like the specific screening of it all. Can you kind of share more insights on that or explain it a little bit more?
Sure. So one of the things that I found fascinating in watching the episode was that Samira and Dr. TJ talked about the very specific type of screening you need for colorectal cancer that won't appear in other traditional cancer screening settings. Like PET scan, for example, won't give you as clear of an idea of whether someone is having a colorectal cancer diagnosis. And so doing the endoscopic sort of screening that usually is recommended at the age of 45 is what Dr. TJ was pushing to kind of advance at least the understanding of its existence and perhaps even start doing it at an earlier age. Because if it's a cancer that goes unnoticed or relatively undetectable except for one specific method, we should be having people do this, more often and earlier, given the kind of epidemic that he refers to in the rise of CRC diagnoses.
Yeah, I mean, I wonder if they, pulled the age down and had more people doing it, if they would like rise even higher, just because you would be getting people in to take that very specific screening.
I think that's probably the case. Unfortunately, it's one of those weird things where you're going to end up with like a bell curve. You want to see the incidences go up in theory because you're helping people, but it's not a fun number to approach. And then hopefully over time, as our screenings and our protocols for treating CRC get better, then it would go back down. But I can only see those numbers going up in the short term, which that's scary. It's scary to think about having to tell more people they have cancer or having to have more people go through it. But if the alternative is it doesn't get caught until later, it's probably a good thing.
Exactly. Like catching it early is always better. So with that being said, education, awareness on this, because it's not overnight that he's going to be able, like, let's do it. Let's go for a younger age set that we need to get people in for. It's really going to be people coming in and kind of asking for the screening or, something else leading up to it. So what's your take on like the education and awareness that needs to be done around this specific topic?
Well, I might be biased, but I think that education around cancer awareness is really important for people of all ages because, I can tell you from firsthand experience that it had never crossed my mind that I would be diagnosed with cancer. I was diagnosed for the first time at 30, and I have family history of melanoma, for example, but a lot of these cancers, like we've brought up, they have genetic predisposition, or you can kind of think of your environmental factors if you're already exposed to the knowledge of the world of cancer. In people who don't have that experience or aren't addressing their family history, I think it's important to place an educational emphasis on like, hey, this is an easy screening to do. It is very easy to go get your skin checked or to get this endoscopic procedure done, even though, it sounds miserable and it's probably not fun to get checked for colorectal cancer. I think the trade-off is probably well worth it. So then the question becomes, how do we do this sort of education? Who is the person providing it? Because while it's awesome to watch Samira and Dr. TJ sit down on an episode of the podcast, most people who aren't in the world of cancer aren't going to watch a cancer podcast. Yeah. And I think that's what MantaCare is setting out to do, is by creating this suite of products and making it easy to see what you should do next if you have fears about this. Because there are plenty of people who are neurotic and fearful of cancer. Like I wasn't one of them. I wasn't sitting around going, oh, am I going to get cancer? But I know people who, semi-hypochondriatic or always thinking about the ways to address their health. And if it was easier for people anywhere in that spectrum, super worried, not worried at all, in the middle, if you could get screened easily and know what you're supposed to do exactly, I think that would be a great step.
Even without somebody being like a hypochondriac or something, like I know that there's a lot of things where you're like, oh, I have a headache and I have this and that. And then the first thing that pops up from WebMD is like, okay, well, you have cancer.
Like, you always have cancer. Every WebMD answers.
Whenever you Google your symptoms. So it would be
nice. Turns out sometimes you do. But
yes, but that's such a great point. Yeah, really disseminating concise information on cancer, diagnosis, questions, resources on all of that is the whole goal of Manta. And it is really great to be a part of trying to make sure that awareness and education gets out there.
Yeah, I think that's why I'm here. And I think that's why you're working with Manta as well. It's that making these things approachable, because no one ever pictures, a 37-year-old sitting there as a 3-time cancer patient. And people don't like to think of that, as the potential for being them. And it's not like I want to scare people. You don't ever want people to walk around, freaked out that they might have cancer, but knowing that you could do something to fully alleviate that fear is probably better than just guessing or hoping.
I mean, that is so interesting too, because I know that really connects with Samira. She was diagnosed at 30 and going through it and trying to understand it, and there was no help for her. So her creating this and you being a part of it is just so great. And all of those who are survivors or caregivers, or every one of us who are involved with Manta, who are really just trying to better the understanding and make sure that when you need the information, you have the correct information.
Yeah, absolutely.
Yeah. Well, thank you, Mike. I want to talk to you more about other podcasts coming up, so I will talk to you soon.
Cool. Thanks for being the host today. This is super fun. I'll talk to you soon.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of MantaCares Inc. or MantaCares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.